My name's Rory Blomberg. I have type 1 diabetes, and I was diagnosed when I was 8 years old back in 2007, so almost 10 years now. I'm making a documentary on type 1 diabetes and endocrinology because I'm passionate about it. I went to a type 1 diabetic camp when I was younger, and that inspired me to want to work with children who also have type 1 diabetes and other endocrine diseases. I have a passion for it. Type 1 diabetes is an autoimmune disease where the autoimmune system attacks the pancreas and leaving it with no insulin production, which is hormone used to break down carbohydrates to create energy for your body. It is not curable and not brought on by the person's dietary habits. When I was diagnosed, I was actually on vacation here in Minnesota, which is funny because I lived in Texas at the time. And I was out at a buffet with my mom and my grandma and my dad and family. And I ate a bunch of food, of course, because it's a buffet. And I went back to my grandma's house with my grandma and my brother and ended up getting very sick very fast. And so my grandma had to call my mom, and she had to come and pick me up. And they brought me to the urgent care, and they tested my blood and they couldn't read it on the meter, so they had to bring me to the ER and get me to Children's Hospital so they could, figure out what was wrong with me. And then shortly after I was diagnosed with type 1 diabetes, and that's when my long journey began. About a few years after I was diagnosed, when I was about 12 years old, I tried to use the Omnipod, which is a little device that delivers insulin into me throughout the day, and when I punch in carbs, it'll deliver the amount of insulin I need for that. It didn't have like a tube that came out of it, it just went directly onto my skin, which I thought would be great, but turned out to be a disaster for me at least. Fell off a lot, got hit off, and so I ended up giving up on that. And then about 2 years ago now is when I started on the Medtronic pump, which is the same thing except it has tubing that connects to like my leg or my arm or wherever I decide to put it, and that gives me insulin throughout the day and also whenever I eat meals. So this is why I'm doing my documentary. Have you ever had a teacher who didn't believe you had type 1 diabetes or never let you go to the nurse to treat a low or a high?
Yes. So I had one teacher when I was in the 8th grade, and I hadn't gotten my flu shot that year, so I was actually developing the flu. And my blood sugars were really high all day, and I was feeling really sick, and I was just starting to run a fever, and I told her that I needed to go to the nurse to test my blood sugar because one of the side effects of high blood sugar, which comes with illness, is throwing up and ketoacidosis and everything. And she's like, I don't believe you, like, where's your ID bracelet? And I'm like, I have an ID bracelet, and it didn't say diabetic exclusively on it. She's like, well, that could be for anything. And I ended up throwing up all over the class, and she's like, oh my god, I'm so sorry. And like a bunch of my friends were vouching for me, like, nope, she's a diabetic. She goes every day before lunch and at the end of the day, and it was really rough. And my 8th grade year again, I had my math teacher. I always had to leave 10 minutes before the bell went off to go check before I got on the bus. And she was always just super like, nope, Alice, you gotta stay, like, you can't leave. I'm like, well, I need 10 minutes, like, all my work's done, why can't I leave? And she was always consistent of not letting me leave, so the nurse ended up writing me a pass, and it was a hassle, but you get over it.
So, was there ever a time you experienced DKA? And if you have, were you hospitalized? Was it life-threatening? If you've had any other life-threatening complications besides that?
I did. So when I was initially hospitalized, I had DKA and kidney failure. Like I said, I was hospitalized when I was 11, and when I went in, my blood sugar was 1,084, which is like, it's supposed to be between 110 and like 200, so, and my kidneys were failing, and my ketones were like off the charts. They told me that if I hadn't come in within like the next week, I probably would have died from kidney failure. So obviously I was hospitalized and diagnosed for that, but after that I've had really highs, high blood sugar from like getting the flu, and diabetics are susceptible to colds and stuff more so I get high then, but it never as life-threatening as it was then.
How has the technology used to manage diabetes, like meters and pumps and such, changed since you were diagnosed? Has this been helpful or improved your management?
I have been using the same thing since I was younger. There's been a lot of improvement and stuff. I just haven't invested in it personally, but I'm sure if I looked into it, it would help me. I've just been using the same Novolog pen basically my entire diabetic life, so I find it works for me.
Yeah. Has cost or availability of medical care been a barrier to managing your ability to take care of your diabetes?
No, I'm on MA, so that covers everything. But I've had lots of friends who struggled, their insurance doesn't cover it. And I know that from personal interaction that it can be really difficult, but for myself personally, I've never had to worry about it.
What are some misconceptions you have heard about type 1 diabetes?
Oh my god, the list is on forever. Mostly what I tell people either say one of two things. They're like, oh, but you're not fat. And I'm like, weight has nothing to do with it. Or all the time, like when it comes to dessert, if we're going out to eat or whatever, people are like, you can't eat that. And I'm like, I'm pretty sure I know what I can eat. So, like, please don't tell me how to save my life, because I know what I need to do for myself. But I don't know, like, I've had people say lots of just kind of ridiculous and ignorant things like, oh, I didn't know that you would live more than like 10 years after being diagnosed, and all sorts of just really crazy stuff. I don't know, people think that they're so educated on topics, and they're not, but you deal with them.
Yes. Do you feel that others should be educated more about type 1 diabetes? And if so, how, when, where?
Absolutely. Not just for diabetics, because we have to go through training after being diagnosed in the hospital, but I honestly think it should be something that's taught in school, like sex ed and everything else. There are lots of people, especially juveniles, who have diabetes, and even if you're not closely interacting with a friend, it's good to know what to look for in other people. Because, I could be having low blood sugar and having all sorts of complications, and if you don't know what to look for, and I can explain that I need help, it would be incredibly beneficial for someone to know. And two, I think it would help to dispel some of those ignorances and what people just assume when they hear the word diabetes.
What is treatment like for cystic fibrosis related diabetes?
They treat it like type 1, so it's like type 1 diabetes. Except, my body is still producing insulin. So, just very small amounts and not enough to actually, combat the amount of food that I'm eating and digesting.
What's it like living with cystic fibrosis related diabetes? How has it affected your daily life?
Well, with cystic fibrosis, I've always had to take pills, enzymes, to actually be able to eat my food, because my body just says, no, we're not going to let you digest this stuff. And if I forget to take the enzymes, or just can't take them for some reason, and I eat food, there are going to be consequences. I will get bad stomach aches, really bad stomach aches.
Mm-hmm.
And then when I got diabetes, it was added to that, I had to count carbs, and I had to account for the units of insulin that I had to take. And so now, instead of taking me 5 seconds to count out the number of pills I need to take, it takes me 5 minutes to measure my blood sugar, account for the number it's at, or not account for it, and then take the amount of insulin I need to actually be able to eat food. And on top of that, I still have to take the pills that I need to take. So,
how did you find out that you had cystic fibrosis related diabetes?
okay, buckle up, everyone. It all started in 8th grade. So in the spring, I do have yearly checkups with the doctor, because, cystic fibrosis is also a chronic illness, and I need to make sure that my lung function isn't going so far down. Um, so during that, they also take like a couple ounces of my blood. Um, and they do tests on it. And so the doctor that I see, she was like, well, your blood sugar might be a little high, but I mean, it's just a little bit high. I mean, it's good. You're fine at the moment, so, like, yeah. And then it kind of stayed there for a while, I guess. And then she's like, yeah, it's a little bit high, but at the same place it was last time, so you're okay. Yeah, and then during summer, during summer, I guess, my blood sugar just kept going up steadily. And then about a week or two after my birthday, I was going to go at the not paying job at the library I was working at the time. And I was just like, you know what, Dad? I don't think I can do it today. I'm just tired. And he's like, well, okay, I'll just bring you home then. And so he brought me over to my mom's house. And then, like, as we were there, the hospital called my house and was like, oh my God, your blood sugar's at 500. You need to get over here now. Yeah, so basically, we packed up my stuff, and just hightailed it over there. And Mom was already there, and she's like, oh my God, what happened? And I'm like, well, my blood sugar is supposedly at 500, so,
Right.
yeah.
My it was kind of a shock to my it wasn't really a shock because both my mom and dad have had diabetes in the family for like the past whatever years. But um the one who like really noticed it was my mom, and because I was drinking a ton of water, I was going to the restroom a lot, and it was just like in one day, just all of a sudden I was immediately a different kid. And so she took me in. She had to really fight for them to be like, no, like he's diabetic, and they like wouldn't believe her. They just ignored her. But in the end, I think my parents uh, handled it so well that like it never really affected me with the rest of the family as well, because they just looked to my parents. They're like, what should we do? And my mom and dad were like, okay, we've already studied up. This is what we do. Don't even worry about it. So that was really like the main thing is like when my parents handled it so well, it affected everyone else, and it just became like a normal part of family life. I went there with a bunch of friends a couple days ago, and I started to prick my finger, and a woman kept looking at me. She was she seemed like really weirded out by it, like she had never seen like such a young, I guess a young adult do it before. And she came over and she was like, "That's making me uncomfortable. Can you move?" And I'd finished like minutes ago, so I don't know the problem with it. But like it kind of like if it happens so often, like I'm lucky to have people around me at the time who were like, "It's just a normal thing, lady. Like leave him alone." But like it's really weird if you're like with people who like have just so used to it, they're like, or like people who are new to it and they're like, "Yeah, like it's kind of making me uncomfortable." It's like, well, just look away. Like you don't have to look at me. You don't have to look at me doing it. But the woman came up to me and she was like, "Can you leave? Or not leave, but like, can you go to another spot?" I'm like, lady, I had finished 5 minutes ago. You were staring at me. You didn't have to. I'm not a zoo. I'm not an exhibit. Just let me. I'm a 19-year-old kid. It was a whole thing. But I had great friends there who were like, he's not leaving. We're not moving. You can go to a different spot. You don't have to burden us with your. Yeah, that happens like once every blue moon. It doesn't. It's at the point where it's no longer a burden Like I know a lot of people say it is, but it's no longer a burden. It's more like a hassle. Like it gets in the way of some things. Like you're like, oh, I really wanted to eat right now, but I also have a blood sugar of like 284. Do I eat and bolus, or do I just wait it out like another 10 minutes till I'm like below 250, and then so it's more stuff like that. Whenever on the rare occasion I do work out, it's a little annoying when in the middle of a running motion, your hand gets stuck in the tube of a diabetic pump, and then you have a moment where you like fall into the like just you get thrown off of the running machine. You're just like, oh god, like you're in more pain because of it because your balance was thrown off. But it's a little weird when I'm trying to work out with someone and they're just like, oh, can you do this, this, and this? Like it's less food now and more just people asking if I can lift weights. It's like, yes, like I have muscles and body. I have a brain, but it doesn't get in the way. Um, it's more of a hassle. Yeah, that's how I describe it.
So, getting to my middle part of my documentary, the parent interviews, I'd like to talk about why I interviewed parents. Um, I thought it'd be a really great idea to do so because type 1 diabetes doesn't only affect the person who has it, but the people around them. Whether it be a friend, a partner, a parent, a grandparent, a sibling, it affects every person you meet, really, if you get to know them that well. Um, I had two friends from camp, both with type 1 diabetes, and one of them passed away from DKA, and the other one passed away. They don't believe it was diabetes related, but it was still very hard and rough because they were both very young. But it really strikes a lot of worry into like me myself having type 1 diabetes, knowing that like any day like I could go because of it, or like even like my friends and other people I know, like it worries my friends, and they're always like, oh, did you check your blood sugar, like you doing okay? And so it really affects a lot of people. What was it like when you first found out your child had type 1 diabetes?
It was scary. A lot of emotions kind of ran through, I didn't know anything about it. And so I think that was probably the scariest part, is not understanding exactly what the disease was.
Have you ever been worried about your child getting hypoglycemic at night or having other medical problems at school or when they're away from you?
Oh, of course, all the time. I don't think that ever goes away.
How long did it take for you to get used to the daily routine of type 1 diabetes?
I would say it took probably a good year to get used to it. But of course, you really, you work quickly to deal with it. But I think to get used to it, it took probably a good year.
How has technology for type 1 diabetes helped as it's evolved over the years? Has it made things easier for you as a parent?
Yes, and in the scheme of things, you've only been diagnosed for a short time, considering how long diabetes has been around forever. And I know when I was growing up, I had a friend that had type 1 diabetes, and she would give herself shots all the time. Didn't really test her blood that often. She had to control her diet. So even from that point, from when I was young to where you are today with your diabetes, it's made huge leaps, and definitely makes it, I think, a lot more manageable for people.
Have you met other parents whose kids have type 1 diabetes? Could you relate with them about the troubles of that?
Yes, I've met quite a few people whose kids have type 1 diabetes. A good friend of mine from high school, her daughter was just recently diagnosed, and I can really, connect with her and understand exactly what she's going through.
How did you go about informing yourself about type 1 diabetes?
We were fortunate because when you were diagnosed in Minnesota, we went through classes, and then when we returned back to Texas, I attended another class. So a lot of education going on through the medical system, which was great. And of course, doing my own research online, visiting with other people that were, exposed to type 1 diabetes, and then also through JDRF. That was pretty helpful too when you were first diagnosed.
What are some positive outcomes you've experienced with your kid being diagnosed with type 1 diabetes?
I think that it's definitely made me more aware of the disease, and it's educated me. So I feel like I've learned quite a bit about it. I think it's given me different aspects into other people's lives, being a part of JDRF, doing fundraising and things like that. And I think one thing that definitely is positive about it is that when we did those fundraisers, raising money for JDRF, is that you really got to see our friends and family, come together and try to raise money for a cause that we believe in and that, is so close to the heart.
All right. Has anyone ever made upsetting comments about your child having type 1 diabetes?
Yes, this happens all the time. The most recent incident was that my child and I were in a store and we got up to the cash register and I had to check his blood sugar, and the cashier said to me, well, I would never let my child get diabetes. I don't let my child eat enough sugar to get diabetes. So there's always the blame. People are always blaming me. They just don't understand the physiology of it. Another one that I remember that sticks out as being particularly bad while my child was with me was when someone said, oh, you have type 1 diabetes. Yes, my grandmother had diabetes and she had both of her legs amputated. And my child doesn't need to hear about your grandmother losing her legs. He's a little kid and he needs to be able to just be a little kid.
What was it like when you first found out your child had type 1 diabetes?
Well, it was obviously a big crash course in learning the physiology of it and learning how to feed him and learning how to give injections and learning about all the equipment. I already had a child with celiac disease, so cooking was already a big deal, trying to keep the gluten out of everything and using alternative ingredients. And so then it just got even harder when I had to start weighing all the ingredients and carb counting everything and coming up with not only gluten-free food, but also knowing the grams of carbs per gram of weight, and it just really, really is very complicated.
Definitely. Have you ever dealt with people who didn't understand type 1 diabetes and said uneducated assumptions about your child?
Yeah, I think that there is a big misunderstanding in society about the differences between type 1 diabetes and type 2 diabetes. And usually when people say diabetes, they really mean type 2 diabetes, and they don't understand that type 1 is a totally different illness. And so people are telling me all the time, well, why don't you just feed them healthier food and then it'll go away? And that's just constantly blaming me, like I'm feeding my kid Twinkies and soda all day and I should just learn how to feed him healthy food and then his diabetes will go away. So that happens all the time. The other uneducated comment, that when he was first diagnosed, I read that people sometimes get this comment and I thought it was so stupid that they couldn't be serious. Nobody would ever say this, but it happens a lot, is people say, oh, your child has diabetes. I know exactly what that's like because my cat has diabetes.
How do you handle the daily routine of type 1 diabetes with your child?
Well, like I said, our meals and snacks are pretty routine. I check his blood sugar about 7 to 10 times a day. His continuous glucose monitor has to be calibrated twice a day. And I usually give him about 7 injections every day.
Have you ever been worried about the financial part that comes with your child having type 1 diabetes? If so, elaborate on what was stressful and what wasn't as much.
Yeah, especially now, given the current political situation with the repeal of the Affordable Care Act. Before the Affordable Care Act, the kids and I were on private insurance, and because of his pre-existing condition, our premiums were about $1,000 a month with a $10,000 annual deductible. And that's really financially unsustainable. So it really worries me that with the repeal of the ACA that things are going to go back to a situation more like that.
Okay. And the last question, what are some positive outcomes you've experienced with your kid being diagnosed with type 1 diabetes?
Well, it's really lovely to see the courage with which he's faced this, and the maturity with which he handles it, and his compassion.
Awesome. I'll start with the first question. Has anyone ever made upsetting comments about your child having type 1 diabetes?
Nobody's really ever made upsetting comments, but people have made uninformed comments. They weren't really upsetting to me. It's just comments that are uninformed.
Sure. How long did it take for you to get used to the daily routine of type 1 diabetes, or are you still not used to the routine?
It doesn't take long to get to the routines, but the routines have changed over the years. For example, today we're looking at continuous glucose monitoring for maybe improved stability in blood sugar levels. So we're trying to figure out how that works and get that going. So that's a new part of the routine. So it's continuously changing. It doesn't take long for me as a parent to adjust, but we like to stay on top of it to get the best insulin treatment possible.
How has technology for type 1 diabetes helped as it's evolved over the years? Has it made things easier for you as a parent?
I think it's definitely made things easier. For example, the glucose monitoring I just mentioned, as well as being on the pump. And the technology today is outstanding, accurate with blood sugar readings, and so I think it's definitely helped.
Have you ever dealt with people who didn't understand type 1 diabetes and said uneducated assumptions about your child?
Yes, I have. But they haven't really said anything about my child. It's just they've said things in general, misconceptions, like, geez, can't she just exercise more and it'll go away? They don't understand that it's an immune deficiency, and type 1 diabetes is not the same as type 2 diabetes. So yeah, there's a lot of ignorance surrounding diabetes in the general public.
How do you handle the daily routine of type 1 diabetes with your child?
Mostly hassle, worry to test their blood more than they want to. As a parent and of a child that has type 1 diabetes but is pretty much 100% self-sufficient, I don't have to do a lot other than hassle to check blood sugars sometimes.
Have you ever been worried about the financial part that comes with your child having type 1 diabetes? What was stressful and what wasn't as much?
I'm not really worried about the financial side. It's just, it's the price you're going to have to pay. So it is what it is. You're going to make whatever sacrifices you need to make to make sure that you have the care and treatment and all the stuff you need. So yes, it's stressful, sure, because it was stressful at first, but it hasn't been stressful for a while.
What are some positive outcomes you've experienced with your kid being diagnosed with type 1 diabetes?
Some positive things have been I've learned a lot. I've learned a lot about health, and I've learned a lot about the endocrine system that I never even knew anything about. And some other positive things are that it helps all of us maintain better diets, typically, having healthier foods, less refined, processed, sugary foods around the house.
Awesome.
Slide us in to the last part of my documentary. I'll kind of explain what endocrinology is, because I interviewed a few endocrinologists for this part. And endocrinology is the study of the endocrine system, and the endocrine system is like the glands that produce hormones in your body. So it regulates your growth, puberty, and like how you process energy, because the pancreas is an endocrine, in the endocrine system, which produces insulin, which I said before. So that is kind of what an endocrinologist does, is they meet with diabetic patients, type 1 at least, every 3 months to make sure their A1C is good, which is like your blood sugars overall in the past 3 months. If they've been in a good range, that number tells you if they have or have not. To make sure that you don't need to make any big changes to the insulin you're giving yourself, how much, and really just to make sure that you're doing okay, because with diabetes come a lot of complications, and a lot of other things, like depression is twice as likely in people who have type 1 diabetes and that kind of thing. So it's good to have a doctor to check in with often. And my plans for the future, like I said, I was inspired when I went to camp to work with children who have type 1 diabetes. So I want to become a pediatric endocrinologist. I want to work with children who have type 1 diabetes and other endocrine disorders as well. Just because I personally think it would make a huge impact if, I do become an endocrinologist and I have a type 1 diabetic patient and they're young and they're struggling with it, I can give them advice that is genuine, because I know what they're going through and I understand how hard it is to take control and really keep it in check. So I think that would be a really powerful and big impact to be able to do that. So it's very important to inform people about type 1 diabetes, even if they don't know anybody with it. You never know, you could get diagnosed with it even as an adult. That's a thing. People don't realize type 1 diabetes happens in adults as well. So knowing the signs and symptoms is really important, because if you are having the symptoms and you don't realize it, then like it could kill you. It's life threatening. It's very important to be able to know and what to look out for, because it could save someone's life. And I think it's also important because a lot of people with type 1 diabetes get not a lot of bullying, but a lot of like misunderstanding, and it can get frustrating when you have to live with it for the rest of your life and hear those comments for the rest of your life. So it's good to inform people about things like that.
All right. In a typical clinical day, how many type 1 diabetics do you see?
I usually see anywhere from about 6 to 8 patients with type 1 diabetes per day.
Okay. How do you feel about the advancement in technologies in the field of endocrinology? Has it made your job any easier?
So there are a lot of exciting advances in the field. I think, I really do try to think of it not necessarily as making my job easier, as trying to make people's lives easier who are living with diabetes. I think that the biggest advances right now in the field are in the area of insulin pump delivery and glucose sensing. So right now, probably the most exciting thing is that there's a new insulin pump coming out that is going to be able to adjust the amount of insulin that is being delivered to a person based on their blood sugar as measured by a sensor. So the idea is that ultimately it's going to be almost sort of taking the patient out of the equation by letting the device measure and administer, measure blood sugar and administer insulin according to what the person needs at that time of day. So this new pump that's coming out is really exciting because it's sort of a step in that direction. And so I think we're going to see, in some ways, life getting easier for people who have type 1 diabetes who are having to be constantly vigilant about their blood sugar all the time. I think the sort of downside to some of it at this point is that with this technology comes a lot of data, and it can be a little bit overwhelming for people to have so much data at their disposal, because again, they're already living with it, but they then have to try to figure out how to use that data throughout their day and night to make decisions about their diabetes, and that's not easy. So I think it's a mixed bag in terms of the advances, but I would say that it probably has made people's lives easier in some ways, and if it makes their life easier, it makes my life easier. So that's kind of the purpose, I guess.
What was the process like to become an endocrinologist?
So to become an endocrinologist, you have to go to college, and you have to not necessarily major in a science, but you have to take all the credits that are required to then go and apply to medical school. And then after medical school, you have to do a residency. When you want to do endocrinology, you can either go into adult medicine, internal medicine first, or pediatrics. And you can also do both. You can do med-peds, which is both medicine and pediatrics, and some people do that. And after you do a 3-year residency in that field, then you would do a fellowship in endocrinology, and that's usually 2 or 3 years. And that involves also some research, usually in endocrinology. And at the end of that, you are either an adult endocrinologist or a pediatric endocrinologist, or in some cases people are both. Although that is pretty rare. I only know one in the Twin Cities who's both adult and peds. But.
Do you know anyone personally, family, or friends who have type 1 diabetes? Did they ask for advice? Do you give them advice? If not, do you know anyone with any other endocrine diseases or disorders?
Yeah, I do. I know a couple of people with, personally, it's hard to discern now because I have so many patients with type 1 diabetes who I think of sort of as friends. So I have a few friends outside of my practice who have type 1 diabetes. I would say they don't really ask me very much or confer with me. I mean, I definitely ask them about, things that they do and how they manage it, just because it really helps me to be able to give, good advice to my own patients. I definitely have a lot of friends who have thyroid conditions, which is another common condition we see especially in adult endocrinology. And so I would say probably those friends and family members would be more likely to ask about their thyroid conditions, which of course I'm happy to share whatever I know about it. Yeah.
How does hypoglycemia or hyperglycemia affect the brain?
Both hypoglycemia and hyperglycemia have bad effects on the brain. So with too low a blood sugar, your brain relies on glucose or sugar for its fuel. And so without it, your brain really can't function normally. The same is true with hyperglycemia. Too much sugar is also toxic to the brain as well. And so when people have hypoglycemia, a lot of the manifestations in the brain are that they can't think straight. They may have confusion or forgetfulness. They may even have personality changes when their blood sugar is low. That is not good for the brain, as well as not good in the immediate, whatever it is they're doing in the immediate, whether it's they're in school, whether they're driving, whether they're talking to their friends. I mean, anything. It's just never really a good situation. Hyperglycemia, on the other hand, is not good more kind of over time. So when the blood sugar is high all the time, that can cause some problems to the brain over the long haul. Also, even in the immediate, when somebody's blood sugar is high, it can also make them feel very, very sluggish and tired, and again, hard to concentrate. So, of course, the purpose is to try to keep the blood sugar in the normal range as much as possible, which is not possible when you have type 1 diabetes. So it's kind of finding the balance there. And that's partly why I think some of the newer technologies are really exciting, because it does allow people to have, I think, a narrower blood sugar range where they can feel comfortable and where their brain is working optimally. I think we've learned so much about hypoglycemia now in the brain, and it's really, it's really deleterious. I mean, it's very, over time, it's really not good to have repeated low blood sugars, and I think we've learned that when people have that over time, it does tend to cause changes in the brain that really aren't reversible down the line. So even though we've pushed for people to have really good, tight control of their diabetes to prevent complications of diabetes, it's also not good to have all the lows that it takes to keep it really tight. So, I think most endocrinologists are kind of really focused on trying to avoid hypoglycemia, acknowledging that it's going to happen to everybody from time to time, but minimizing it is a priority. And that's where I think continuous glucose sensors especially have become so helpful for that, giving people an alarm that their blood sugar is getting low before they get there.
What are some of the most common endocrine diseases and disorders that you see on a daily basis?
Yeah, so diabetes, number one. I probably see about 60 to 70% of my patients every day are seeing me for their diabetes. And the breakdown there is that, probably 2/3 of them have type 1 diabetes and maybe 1/3 of them have type 2 diabetes. I also see women with gestational diabetes, which is diabetes just in pregnancy. And so that's also, kind of a smattering of patients with that. And then the second biggest diagnosis I see in clinic is patients with thyroid disease. And that would be either hypothyroidism, underactive thyroid, or hyperthyroidism, or also thyroid cancer. And then probably the third the sort of third tier of patients that I see is either for an adrenal problem, so usually an underactive adrenal, a pituitary problem, which is the gland in your brain, kind of right inside your brain, hypercalcemia, which is making too much calcium, and that's due to another hormone called parathyroid hormone that's in your neck. And then gonadal problems, so premature menopause in women, or low testosterone levels in men, or polycystic ovarian syndrome, which is another gonadal problem for women.
Okay. And how many new diagnoses of type 1 diabetes are you part of in a month or a year?
Probably in a year, because I'm an adult endocrinologist. I probably see 2 to 3 new diagnoses of type 1 diabetes, mostly because most type 1 diabetics, mostly people with type 1 diabetes are diagnosed in childhood and then they see a pediatric endocrinologist. However, we can diagnose it in adulthood, and we see that more and more. And so I think the oldest person that I've diagnosed with type 1 diabetes was in his 60s. So it does happen, and it's always very, very surprising for patients to be diagnosed with this when they're an adult. People generally think you just can't get it when you're an adult, or you've passed the point, or things. So, so there's a lot of kind of education and things that go into those visits, because it's usually generally kind of coming out of the blue, as it is for kids too. But I think it's more surprising somehow it's more surprising for adults. So, yeah.
Okay.
In a typical clinic day, how many type 1 diabetics do you see?
It turns out it's very variable. You're welcome to check that. At the most I have is 15. I've had as few as 2. And it really depends on the day and the situation and all the factors that go into how the schedule works. But at most 15, as few as 2.
Okay. What was the process like to become an endocrinologist?
Long and rigorous and fraught with challenge and obstacles. What was it like? That's a big question. It was a lot of time. Something unique about me, I double trained for peds and adult endocrinology. I thought I was going to do the entire lifespan. And so that was 16 years of time after high school. So 4 years of college, 4 years of medical school, 4 years of residency, 4 years of fellowship. And so you don't have to do all that to be a peds endocrinologist. At minimum, you have to have 4 years of college, 3 years of 4 years of college, 4 years of medical school, 3 years of residency, 3 years of fellowship. So there's a few years nicked off of what I did if you just do the peds route. So, but fascinating time in your life. Tons to learn, fire hydrant style knowledge being released at you. So much to learn. You really have to learn the entire spectrum of pediatrics before you become an endocrinologist. So you really get a sense of all the vast array of problems. But yeah.
What made you want to become an endocrinologist?
So, medical student, North Carolina, somebody says, you want to come volunteer at diabetes camp? And I said, okay, I'm pretty free this summer, which you have pretty free summers in some medical school, depending on what you do. So I decided to go check it out and had a blast and was just, again, enchanted by unique kids having to do something I had never seen before, having to think of their bodies multiple times a day, do difficult tasks. This was completely new to me and was different than anything I had been learning about in classes and seeing in the clinic to that point. And so I really fell in love with it from that angle. I think as I went forward, realizing that there's, that most of what you take care of in endocrinology is a lot about using your brain and being able to communicate really clearly to patients and their families what's going on. It's very cerebral. So, being a good educator and teacher, what's going on, and being able to listen to their stories and symptoms well. There's a lot of using your brain and not so much doing procedures and things. So there's a lot of different fields in medicine where there's a lot more scopes and procedures and being put under for things, and I had no love for that. And so I think the combination of camp, using my brain, loving teaching people things, making a lot of things significantly better was really fun too. So taking somebody who's sick and vomiting and just got told they had diabetes to a vibrant, back to normal, this is the kid I missed 1 week later, is very satisfying. Thyroid can be similar. People can be really ill and off from it, and then you get back to normal. I think that's really satisfying. So.
Where did you attend medical school? What was that like for you?
I went to Wake Forest University in Winston-Salem, North Carolina, and it was, I will never forget it. What I remember about my medical school experiences are the close friends I made for life that I still talk to and just texted in the last few days, and we stay in touch. Kind of a rich, classical, historical feeling sense of professors who had a sense of the old and a sense of the new. So the styles of learning we got to experience and the sort of rituals of anatomy, and I think all those things are really what stay with me the most about it, and just some fascinating personalities for professors that left impact on me, including endocrinologists that are still a part, and were also probably part of my interests. So some of those early influences were big.
how does hypoglycemia or hyperglycemia affect the brain?
So, wow, specific medical question. Hypoglycemia, so because it's fuel for your brain doesn't get too happy when you're low in blood sugar or hypoglycemic. So people describe anywhere from just feeling off or confused or out of sorts or disoriented to anxious. These are going to be, you're literally underfueling your brain. And so the most extreme example is your brain isn't getting enough energy, and so you pass out and you have a seizure where the electrical activity of your brain is out of sorts, and you are completely unconscious of anything going on and on the floor and visibly, out of it and potentially writhing around like this. So it's a very visually scary thing for our friends and family to see, distressing and scary for all involved. Hyperglycemia is going to have more of a worst case scenario, can lead to swelling of the brain, which is actually one of the reasons why getting ketoacidosis, or a very severe illness from missing a lot of insulin, can lead you into the hospital, can lead you into death, is swelling on the brain that thankfully is very rare, but is a potential complication anytime there's severe high blood sugars. Swelling on the brain can happen. So I think that's the thing to mention with hyperglycemia.